Joseph Page, what are the two negative tests looking for to declare you as not able to transfer the virus to others? Jerry West, Germany's discussing plans to roll out the antibody tests and give certificates to people who can go back to work. That's a really good point. And I just have to cover this comment. Someone did about a page and a half set of comments telling why they think the antibody test is so important. I could not agree more. The antibody test is very important. And here are a couple of the reasons why, or one of the major reasons. We're going to start going back out at some point, coming back out of isolation. And as we do, as a society, as a species, that antibody test is going to be critical. Right now, when we're in the uptick of that hockey stick, what we need to know is not whether or not somebody's had it in the past. What we need to know is if somebody is infectious.
Right.
We're missing at least 2 weeks. It takes 2 weeks to form IgM antibody and 3 weeks to form IgG antibody. And that's what's been creating this uptick. In New Orleans, when they were having their parties.
Right.
What was the big party they had in New Orleans?
Mardi Gras.
In Mardi Gras, and the big parties on the beach in South Florida. We needed to know then who was infectious. That is not the antibody test. That is the PCR, the virus itself. So getting into an argument about which test is more important, the viral RNA test or the antibody test, is sort of like getting into a debate about what's more important on a car, steering or brakes. You need both. You really do.
Well, the next question alludes to the testing needs to be of both types. Do you have it, and did you have it? This gives the real picture.
Exactly right. Thank you very much, David Jones. I should have just read your comment, and maybe that would have saved us all a lot of time. Joseph Page, what are the two negative tests looking for to declare you as not able to transfer the virus to others? Again, we've gone back and forth on that several times. I think that what people are referring to is there are two types of tests. One is PCR, polymerase chain reaction. You don't need to remember those terms. It's looking at the RNA, the genetic material of the virus itself. We know to look if there's the virus inside the oropharynx when you swab it. And we used to think we had to jab the swab. Someone else had to jab the swab all the way back. What we found just over the past weekend is that you get almost as good results. In fact, maybe as good results for the individual themselves to put the swab up here. That's looking for the genetic material of the coronavirus in the nose or the throat. The other test is looking for the antibodies that your body makes. So, Joseph, I think that that's what that reference is. Two negative tests, no antibody and no transmission. At that point, you still could have, both of those could be false positives. And you mentioned that earlier. How could that happen? Okay, so there's a thing called incubation period. That's the time from the time that,
Asymptomatic.
There's what? You get infected today. At 3, you're going to maybe test positive on the virus test. And then it's not until day 14 or more that you're going to test positive on the antibody test. But days 1 to 3, you can still get both of those tests as negative. So very good point. Thank you for bringing it up. So I'd like to talk with you a minute about the webinar. People don't understand what the webinar is. It's actually a great way to get some access to healthcare that you're just not going to get any other way. You actually get the lab tests yourself at a local lab, a Quest lab near you, for the inflammation panel and the OGTT and the insulin survey. These are things, inflammation and prediabetes, that your doctor just does not know about. And here's the thing. Harvard Health and many others have said, look, sudden death is not always so sudden. The Hollywood picture that it's a bolt out of the blue is not realistic. It's more like real lightning, preceded by clouds, wind, and rain. Stop that metabolic storm before the lightning strikes. And here's where that metabolic storm comes from. It's inflammation, and it has to do usually with prediabetes. So again, we actually get labs. We go over them in the webinar, and then you can start finding out how you can prevent that heart attack others said that you couldn't even predict. We can show you how. Thanks.